Susan, can we get started?
Looks like people are still signing.
Sorry, Susan, can we start?
You can do. It looks like people are still signing quite rapidly. At 240 at the moment. So maybe
I don't seem to have control of these slides. There's a delay. Okay. Okay, it's 9 o'clock UK time, so let's make a start. My name is Aziz Sheikh. I'm director of the Usher Institute at the University of Edinburgh, and I'd like to welcome you to this webinar today that we're holding on COVID-19. This is the first of our webinars, and we hope to continue to run these for as long as it's going to be useful to colleagues. So a very warm welcome to everybody who's joining us on the Zoom platform. Because we've been overwhelmed with interest in this webinar, we've also opened it up and are live streaming it on YouTube. And we've got colleagues joining us from across the UK, but also from much further afield. So we've got colleagues from Colombia, Greece, Isle of Man, Italy, Lithuania, Nepal, Pakistan, Peru, Saudi Arabia, Singapore, Thailand, the US, and possibly also many other countries. So a very warm welcome to all of you. Before we get stuck in, and I want to ensure that we give maximum time to the presenter, I just want to say a couple of words of thanks. So first of all, thanks to Linda Bald and Susan Buckingham and the comms team from the University of Edinburgh, who've really worked incredibly hard to put this event on in record time. Most importantly, I'd like to thank Professor YY Teo, who's joining us from Singapore. YY, we realise it's towards the end of the day for you and that you're staying on, and we're incredibly grateful for you making the time. Our rationale for putting on these webinars is really very simple. It's to try and derive actionable insights that we can hope save lives from this evolving pandemic. That's saving lives directly as a result of people being infected with COVID-19 and its complications, but also as a result of the crippling economic effect this is happening across the globe. So that's our rationale and our reason for drawing on expertise from Singapore in the first instance will, I hope, become evident during the course of this webinar. Susan, can you move to the next slide, please? This seems to be freezing. This isn't proceeding. Right, so you'll have to bear with us. It's the first time we're doing this. We're all getting used to this new way of working. Maybe, Susan, if you can just take back control of the slides, because I can't seem to get this to progress. Okay. So just while we're waiting for that, let me give you a brief bio of YY. So YY's trained as a mathematician at Imperial and then read statistical genetics at Oxford. He had a spell as a lecturer at Oxford and was also working at the Wellcome Trust Centre for Human Genetics. He then returned to Singapore and was involved in setting up the Centre for Health Services and Policy Research, and was also the director of the Centre for Infectious Disease Epidemiology and Research. So very, very pertinent skill set. And YY currently serves as the Dean of the Hock School of Public Health at the National University of Singapore. And if you could just proceed to the next slide, please, Susan. It seems to be freezing. Okay, so this is my last slide that I wanted to share, and I hope the slide deck runs better for you, YY. But these are data that John Hopkins are pulling off regularly, summarised in the Financial Times. It's a trajectory of various countries in the course of this pandemic. As you can see, the UK is on a very steep rise at the moment. We're projected to peak in terms of both new cases and also mortality over the course of the next few weeks. So we're really, still bracing ourselves for the worst of this. But as you can see, Singapore is an outlier in this respect, and we're very keen to try and learn from colleagues in Singapore what they've done and any transferable lessons that we might be able to derive for the UK and beyond. So YY, over to you. Thanks so much for joining. We really appreciate this.
Right, thank you very much. So I'm sharing my screen right now, and I hope everyone can see this. So before I start, thank you very much for people who have joined from different parts of the world. I hope that in my sharing of what Singapore has done, it will provide a guide in terms of helping different countries decide on different measures that will be appropriate. One of the things that I will emphasize is that during the talk, please do spend some time to think about some of the measures that I talk about and whether they are relevant in your own country's context, particularly taking into account of the socio-economic development, the cultural context, and also the availability of technology and others. So it is very important right now that we have a very appropriate evaluation of what are the individual's country's capability and capacity to adopt certain measures. And if we are unable to, what are the other methods and measures that we should be adopting? Quick mention that what I'm presenting, it's actually from a public health perspective, and I do not represent the Singapore government nor the Singapore Ministry of Health in any way. And this is not meant to give a comprehensive review of all Singapore has done, but some of the key pertinent aspects that I feel from a public health perspective, it has been most relevant and most effective. Now, I think it's important to start off by saying that Singapore, we had our dry run of managing pandemics from what happened in 2003 with SARS. And Singapore was hit quite badly by SARS back then, and we very quickly realized what are the gaps in our health system, what are the gaps in the societal responses that we need to put in place. And that's where we have a phase of learning, and we are starting to see perhaps some of the lessons that we have taken on board to be proving effective at the moment. So it's important to start off by reflecting what is the current situation of COVID in Singapore. This is a graph looking at the epidemiological curves since the start on the 23rd of January. And if I could just draw your attention to the left panel, the highlighted part in blue, you would see that in the parts of January and February, the red line and the blue line pretty much track each other very well. They were almost parallel to each other. The red line indicates the number of new cases, the number of cases, cumulative cases that Singapore had at that particular point in time. The blue line indicates the cumulative number of discharged or recovered cases that we have. And these two lines are particularly important for national responses, because if you see that the red line is very much parallel to the blue line as what is seen in January and February, this is saying that your health system is able to cope very well. The number of people coming in every day is pretty much the same as the number of people being discharged. In that sense, there is an equilibrium state. Most health systems will be able to cope well. But if you now look at what has happened in the past 3 weeks in March, that is where it gets worrying, because the red line has escalated very significantly with a steep gradient, but the blue line is still maintaining a steady increase. It isn't increasing as quickly as the red line. It means that we are starting to see a lot more cases in Singapore, but the hospitals are not able to discharge them quickly enough. It is not a problem at the moment. The Singapore's hospital has the surge capacity, so at the moment we're still able to deal with it. But this is a sign that we should all be concerned with. And that is why I mentioned issues around fatality rates. Those are of academic interest. For an operational perspective, what these two lines that we are saying, the red line and the blue line that we're tracking, are absolutely critical, because no matter which health systems that we're talking about. No country currently has the surge capacity to deal with the load that we are seeing happening in different parts of the world. So this is where we need to be very practical about our capability to handle this disease. Talking about case fatality rates, when health systems are stretched, when hospitals are stretched, this is where fatality will increase. When there is insufficient ICU beds, insufficient ventilators for people who genuinely need it, that means care would be compromised, and that's where fatality rates increase. So that's where I want to highlight the bit about there's a lot of interest around fatality rates in the world, but given what we have seen globally, what is important right now is really to focus on understanding what is the capacity within individual health systems to cope with this. Now, the next slide actually shows the linkages in Singapore. Our people spend a lot of effort, immense effort, to try and identify where each individual case is coming from. Is it coming from overseas? Is it coming from being a community transmission on the ground in Singapore? The case linkages, the contact tracing efforts that Singapore has put in has been phenomenal. I will talk about that separately, but you could see this plot, this graph that I've shown you, it looks like a very simple graph, but there are thousands of hours of effort being put in to really trace. And this is very important for countries that are still in the initial parts of the epidemic spread in their country. Because if there are sporadic cases, there are local clusters, it is still possible to try and trace and isolate people that are in contact with the confirmed cases. This may not be relevant anymore in countries like Italy, like the UK, where there is widespread community transmission, and that is where different methods may have to come in, and we can talk about that in a bit. I wanted to talk about the situation in early March, because as of early March, you could see that the imported cases pretty much came from China. And that is very reflective of the global situation early on. But you could see the case numbers from case 113 onwards, we start to see importations coming from different parts of the world, no longer from China. And that is a very important aspect for countries that are managing the current situation nationally. And if I move on to the other plot, this is the current situation as of last week. You could see right now the importations from other parts of the world way surpass the importations from China. And that is the trend that countries will have to bear in mind as they start to think about what are the travel advisories, what are the measures that need to be put in place to guard against further importations from different parts of the world. So given the situation that I've highlighted, what has Singapore actually done? And I think it starts from the very beginning. I talk about the 23rd of January as the point in time where we saw the first case. Early in January, there were already in the plans to set up a multi-ministry task force to signal that this goes beyond a health crisis. This is a national crisis. It is a global crisis. As such, the response must be beyond a health sector response. It must include manpower, it must include national development, and very crucially, include elements of trade as well as communication. And that's why the task force that was set up, that was governing the response in Singapore, was actually a whole of government response. And one of the things that we did early on in January was that when we saw that there were signals, indications of a suspicious infection that has emerged, because the world first heard about the first case on the 31st of December. From the 2nd of January onwards, we started screening temperatures for flights from Wuhan. This escalated subsequently to all flights coming into Singapore at the end of January. Temperature screening, we again can talk about whether it is sensitive enough. There have been studies from the UK that suggested that temperature screening is at best 50% sensitive, meaning it will only pick up about half of the people with the disease, but this is a measure that can be implemented at a large enough scale that is sufficiently sensitive. If we now look at the left panel, talking about the limitation of entry for visitors, and this is where we started to restrict influx of people or visitors from different parts of the world, depending on the spread in their country. So we have not taken a measure that says from the very beginning, we stop all travelers, but we took a measure that is appropriate given the situation in the respective countries, such as in South Korea, subsequently in Iran, in parts of Italy, and then subsequently to France. Right now, just a couple of days ago, Singapore actually closed the borders to all short-term visitors. This means that anyone that is not a Singaporean, not a permanent resident, or a holder of a long-term work pass will not be allowed to come into Singapore or to transit in Singapore. And I think this measure reflects the current global situation in terms of the spread of coronavirus. Why is this necessary? Because Singapore actually has always been a major international hub for flights and aviation. We see on average about 1 million travelers coming into Singapore every month. And especially during the early months in January and March, we had to restrict travelers coming in from China, given that it coincides with the national holiday season in China for the Chinese New Year or Spring Festival. So there will be a lot of travelers coming from China into Singapore. So that is the necessary response that Singapore put in to restrict people coming into Singapore. Some of them will bear the risk of being infected when they are coming in. In Singapore, we have a response that was set up as part of our pandemic preparedness plan, which we call the DOSCON. It signals to the public what is the level of preparation and what is the degree of spread that the country is currently facing. And in peacetime, it is in green, and currently the situation is in orange. So we moved from a state of yellow to orange slightly more than a month ago. And this actually signaled to the public very clearly what it means and what are the personal responsibility as well as corporate responsibility that needs to be taken when we escalate the DOSCON level to the appropriate colors. At the moment, Singapore is not in the DOSCON level of red yet, where there is school closures, there's closures of workplace, but we are currently in the orange status. We also put in place mandatory social distancing, and this is aligned with our efforts to really try and detect cases early, contact trace who are the people that have been in touch with people that are confirmed cases, and to isolate them quickly. So people who are in contact and suspected to be carriers, they are issued with the strictest order early on, since 28th of January with the quarantine order. What we put in place then is, what about people who return from hot zones in the world? We started off with a leave of absence, which is to get people to stay at home, not to go to work. If they return from specific countries with widespread community transmission, but we realized very quickly that we need to enhance the strictness of this, and we moved to what we call a stay-home notice. The stay-home notice is mandatory, but it is slightly weaker than a quarantine order. That means individuals have to be completely isolated, whether it is in specific government facilities or whether in their home, if isolation is possible. If not possible, they will be moved to government facilities. Stay-home notice is weaker. They can stay with their home family members, but they must remain at home. They cannot go to work. They cannot go out. They cannot go exercise. So those are the mandatory social distancing or physical distancing effort. Next is I talk about the contact tracing, and that is really due to the immense efforts from teams of 10 people each team working every day, every week to really look into how people are moving. And these are people who have been confirmed to be infected. The contact tracing team would actually look interview each infected case, ask them where they have been in the past 14 days, who they've been in contact with. Sometimes there will be gaps in the recall. This is where there is a collaboration with even the police, with the detective, and these are investigation department, very used to solving crimes, but now they've been rediverted to look into how do they use the skill set and the technology to look at footages from CCTV cameras to really learn about how people are moving, which taxi, which cab that an individual has got into, what is the cab taxi number, the car plate number, identify who are the possible people who have been sitting in the same taxi during that period of time. So this is really a cross-ministry effort, not just from the health sector, but also involving the police department to come in. About last week, the government actually introduced a new technology for contact tracing. It is called Trace Together, and the government has strongly encouraged citizens to download this Trace Together technology onto mobile phones. What it does is that it uses a Bluetooth method that individuals who have been in close proximity for an extended period of time, they will automatically record that these individuals have been in contact. It preserves anonymity by recognizing only mobile phone numbers. Only in a situation of contact tracing would it be required that the law will be enacted to pull out data. Otherwise, confidentiality is always maintained. And this is through the use of technology to really try and enhance contact tracing beyond individual recalling. Now, I talk about having a whole of government approach. And one aspect that Singapore has always focused on is how do we communicate the situation very clearly to the public. And there are 3 layers of communication that are necessary. One, it's really about communicating the current state of the disease in the country. The second, it's communicating what are the new rules, regulation, new enforcement measures that should be put in place. And the third is really talking about what are the personal safety measures, personal useful information for individuals and community to know about. Things like hand washing, hygiene, and even information from the World Health Organization. There is a government channel that is exclusively dedicated to this. It relies on the WhatsApp technology. Pretty much anyone in Singapore with a mobile phone will be using WhatsApp. And that's where you can sign up and receive daily updates, sometimes even free updates per day to learn about the current situation and government measures. This has actually helped to clarify a lot of fake news and mistaken beliefs around the coronavirus. One aspect that is very important to talk about must be the clinical preparedness and the clinical responses. Because we had SARS in 2003, the country realized that there is a need for a dedicated hospital that is specific for managing outbreaks. And that's where we have a National Centre for Infectious Diseases. It was rather timely introduced since August 2018. In addition to that, all hospitals actually undergo specific drills, which we call exercise Sparrowhawk, very similar to a military drill, which is meant to simulate an outbreak situation and how would hospitals, especially the frontline workers, cope with personal protection and minimizing risk to other community, other patients in the hospital, as well as looking into what is the protocol to gradually free up intensive care units as well as isolation wards to start receiving cases. Those drills have been very important in Singapore's pandemic preparedness plan. So one key element of an outbreak of this nature is that people typically will present themselves firstly to the GP, the general practitioner, through the primary care networks. And this is where Singapore activated the public health preparedness clinics, firstly to reduce the cost of consultation, secondly having a mandated medical certificate to encourage people with certain symptoms to stay at home rather than to go to work. Through this approach, it is a much clearer signaling to the public where to go when you have certain symptoms. This has been very important in preparing the clinicians and our healthcare workers to respond to the current pandemic crisis. On the financing side, we started off clearly saying that we will pay for the medical bills and testing for everyone that has been infected. But about 2 weeks ago, Singapore changed its stance to only include people who are working in Singapore. That includes the migrant workers and all citizens and permanent residents. This has happened because there were visitors that took advantage of Singapore's healthcare, comprehensive healthcare financing to actually come into Singapore even when they know that they already have been infected, so that firstly they can receive completely subsidized healthcare, and then secondly to take advantage of the healthcare services that are available in Singapore. That is why the country very rapidly changed its approach towards healthcare financing to look after only people that that genuinely have contributed to Singapore, and that includes the migrant workers. I think this bit on healthcare financing is absolutely critical. Citizens and people, the locals in Singapore, must be assured that they will not bear catastrophic poverty if they present themselves for treatment. Otherwise, there will be a situation that people do not seek help, seek professional medical treatment, but remain in the community even when they're infected, and then go on to spread any onward transmission in the community. This is very crucial. Countries like Japan, like Thailand, like China, they have very quickly issued statements to say that treatment will be covered by their universal healthcare schemes or other form of national financing schemes to relieve any concerns and worries around healthcare cost. I talk about the cost, and I also talk about the leave of absence and stay-at-home notices for people. The country realized earlier on that there will be people who worry about their livelihood if in the event that they are exposed. And if they come forward to say that I've been exposed, I should be on a leave of absence or to stay at home, they worry about their livelihood. So the government, in very early on, they actually put in place, and you could see this happens in the late January, they put in place a financing scheme to help people who have to stay at home because they've been exposed. They receive $100 a day for every day of the 2 weeks that they have to stay at home. And there are certain additional schemes for certain people, including cab drivers, that they do get once-off allowance as well as rental waivers. This really helps the individuals with their livelihood and maintaining in terms of providing for the family, but equally it encourages people to come forward to say that I have been exposed, I ought to be isolated from the public and not to be working. Very important measures that has been put in place. I think right now when we talk about multi-sectoral cooperation, this is quite clear that we do see globally that the military has been deployed to help in controlling as well as to manage the crisis situation in terms of diversion of crowds and so on. Singapore, we did that as well. We brought in the military to help prepare masks that are subsequently distributed to members in the community. We also talk about the use of the police, the detectives, to really use the skill set that they have to investigate people movement. And the people here are the infected cases, the movement of infected cases, so we can appropriately identify who have been exposed and who ought to be isolated appropriately. Now, one of the issues that I think globally we are facing is this problem of fake news. There are a lot of fake news in terms of government rules, regulations. There are equally fake news about what one ought to be doing to recycle masks, recycle PPEs, or even what kind of treatments are effective. I see that all this fake news actually harm people, it harm lives, and it actually can result in deaths. So what Singapore has done, again, is to put in place the necessary regulations very early on to say, if you are spreading fake news, we will send you a warning to take down the post or to correct the post. If one doesn't obey, there will be certain laws that are thrown at these people who persist in spreading fake news. In terms of, I talk about using laws to actually control the spread of fake news. This is where we have instances that the country is not afraid to actually use legal measures to enforce. Because what is the point of asking people to stay mandated, stay at home or in quarantine when there are no enforcement of that? So you could see here that there are people who have been charged under the Infectious Disease Act for breaking the law in terms of not staying at home when they have to, or when they are effectively breaching the entry requirements and the approvals that they need to come into the country. Some of the things that I will talk about over the next few slides are things that are increasingly put in place because of the evolution of the situation in Singapore. So we saw that there were clusters earlier on in February that were linked to community gatherings of people who are coming together for karaoke, which is a very popular activity in Asia. And so that was a pain point for the country, and we quickly regulated that to avoid gatherings, large gatherings of people that are coming together to participate in activities that have a high risk of transmission. So you could see that we start to suspend lessons and classes for community centers, and these are places where the public tend to come together for activities, for recreational activities. And we also start to put in place physical distancing measure. If you look at the picture on the right panel, that is a sign of one restaurant. On the right side is a restaurant that has already put in place physical distancing measures by physically barring people from sitting at certain tables. On the left side, you could see that is before a restaurant that has yet to adopt that measure. Even our ministers, in terms of their giving their daily briefing, they themselves follow the rules of physical distancing. And I see that equally as happening in the daily briefings that the UK government is giving to the journalists and to the public. In addition to the community restrictions, yesterday, taking effect yesterday midnight, or rather this morning midnight, there is a widespread closures of entertainment outlets. And again, these are clubs, bars, cinemas, theaters, places where people will congregate in a large crowd in an environment which is rather conducive for the disease to spread. These measures are put in place until the end of April. So you could see that we gradually move up the level of stringency and in terms of the measures that the country is adopting, responding to the situation that we are facing. This is something that happened in the news, and Reuters, BBC has picked up on this as well, that right now, even for individuals to be in public spaces, they should be sitting at least 1 meter apart or standing 1 meter apart. And this is really focusing on non-transient settings, such as shopping malls and restaurants. This is, again, to try and encourage people to maintain the necessary physical distance to minimize personal risk. This is an approach that the country adopts to avoid having a lockdown mechanism, because the option is if communities do not follow these rules, the country may actually move into a lockdown approach. But if individuals are able to follow some of these rules, this allows the country to continue functioning with the necessary movement, people movement, and goods and services movement without requiring a lockdown approach. In terms of the physical measures to try and manage the situation, the fiscal measures announced there were additional budget that was announced yesterday to help individuals, to help households, and to help businesses maintain their resilience during this very difficult time. I won't go through the following 4 slides, and I know that because this is recorded, I will just very quickly flash the 4 slides so people can go back and look at them. But it's really aiming at helping individuals by minimizing unemployment, trying to increase liquidity, cash payments for individuals to tide them through this difficult time, helping to stabilize businesses by deferring costs, minimizing any additional payment, ensuring liquidity in the system, as well as supporting household, particularly the least fortunate and the community, trying to encourage the community to help others as well. So I want to quickly move on to the next part, which is really around how academia and research have been coming in place to guide the national response. And this is where modelers, including people that are in the UK, in Hong Kong, that have been working very hard to come up with models to look at how the disease will spread. Equally, Singapore has relied on a very strong modeling team to really guide the response in the country, where there are specific developments, including technological developments that are made available to the Ministry of Health for them to guide, to chart their response in terms of whether school holidays should be extended, schools should be closed, transportation networks should be closed, and what is the impact to the spread of the disease in the country. By using these measures, by using an evidence-guided approach, it actually helped the policymakers to decide, are certain measures too extreme and unnecessary at this point, or are certain measures too lax and ought to be ramped up? So that has been pretty much the hallmark of the response in the country thus far. At the same time, the government has actually very quickly activated a team to synthesize evidence globally on aspects that are related to clinical characteristics of the disease, diagnostic vaccine therapeutics related to the disease, and what are the global literature around containment measures, perhaps for other outbreaks that have worked or that have not worked in the past. Some of this evidence synthesis are now made publicly available and not just restricted to the government. The link is what I've shown on the web, but I will want to move on to next about what the community, the enterprise have taken on board. One of the features that Singapore has been able to execute is really that of a national campaign. And the national campaign is something that Singapore, for the past 30, 40 years, we have had national campaigns on different aspects. So when we roll out a national campaign saying that it is the individual that is most responsible to contain this outbreak, people do respond appropriately to it. And this is where on the furthest right panel is a copy of the newspaper. Every single day, the front page has a panel that is like this. It reminds individuals that what to do if you have certain symptoms. These days, the front page actually talks about what to do when you are in public spaces and what are the new rules around not congregating in public places. Very similar to some of the rules that have been announced by Prime Minister Boris Johnson a couple of days ago, trying to encourage people to stay at home. But in Singapore, we rely on national campaigns to really tell people, and people do respond very actively on it. When I talk about national campaigns, we also talk about the use of celebrities, songs to really uplift, to bring community people together. We make use of advertisement timing. You could imagine there is a program of a cooking show by Jamie Oliver. The moment that the advertisement comes, the first advert is an advert reminding people about their personal responsibility on what they should be doing and what they should not be doing with respect to containing coronavirus. And that is a very important way to increase health literacy in the community within a very short span of time. You could see we also rely on comics. There are comics that have been produced to really correct some of the myths, including the use of surgical masks and so on. And these are spread in public. We also have business continuity plans, which we call BCP, that has been established as a framework for crisis management, not specifically to COVID, but prior to COVID, we already have business continuity plans that have been established in industry, in education sector, including even in my ministry, my university, in my faculty, we have BCPs that are put in place. What do we do if we now have to shift all learning to online learning format? And this is where having that preparation has allowed the country to continue quite a significant part of our function since the start of the crisis. There's a lot of corporate and social solidarity in terms of the politicians, the policy makers, senior management of different companies willingly stepping forward to say, we will take pay cuts to help to keep businesses in place, to help to keep liquidity in place, to help preserve jobs. And I think that has been very important. One of the issues that I highlighted earlier on was really around migrant workers. And you could now see that in times like this, the migrant workers in many societies, many countries will tend to be the health of the migrant workers will be compromised. They will be the ones that are secondary to the health of the citizens. In Singapore, we have volunteers, we have schemes that are put in place, including the healthcare financing that I talk about, that really look after the migrant workers as well. Because as what Professor Jeremy Lim has said in this quote, that the chain is really as strong as the weakest link. And if we do not look after the migrant workers, if they're infected, they become the vectors that will continue the transmission in the country. So this is a call to all the people who are listening as well. Please do remind your governments that equally they need to start thinking about the vulnerable parts, communities in your country, as well as the health of the migrant workers. Absolutely important. Otherwise, we will not be able to manage this, whether as a country or whether internationally as a globe. At this point, I want to spend a bit of time talking about what factors have allowed these measures to work. And this is the context that I highlighted at the very beginning. Singapore has been very small. And what I've done here is to map the size of Singapore around London. And you could see that Singapore actually is much smaller than the circumference that is mapped out by the M25 ring road. We also have only a limited number of entry points into the country. And that makes it a lot easier to regulate the entry into into the country. If now you compare this situation with many countries in Europe, where because of the agreements that are put in place, people movements tend to be a lot more freer. This has become a problem in terms of trying to manage the importation risk for countries. And the size of the country is a clear benefit at the moment in terms of the agile responses that we can put in place. Secondly, I talk about the national campaigns, and you could see from the very beginning in Singapore's development, we have relied on national campaigns to really move the country's people to really understand that there will be instances where the collective good does surpass the individual good. And Singaporeans generally respond very well to national campaigns. And I see this to be one of the reasons why the people is able to take to the call to be personally responsible, to be socially responsible, whether it is in terms of personal hygiene habits or in terms of the responsibility to be practicing physical distancing. The third, it's really in terms of the trust that people have with the ruling government. What I've done here is actually on the leftmost panel, it is a measurement by Elderman in terms of trust. It's a trust index. And very broadly, you could see that we are very fortunate to have a population that do have a higher degree of trust with the ruling government. And in crisis moments like this, it is absolutely important for the people to trust that the government has the right measures that are put in place to protect them. But at the same time, the government needs to earn that trust as well. And I would say, as a Singaporean, who has spent many years overseas during my professional career, I have not seen many other countries that spend so much effort, the governments of the other countries spend so much effort trying to maintain and retain the trust of the population. And that is where the trust has come in very important when the citizens of Singapore is able to follow the advice and to trust that the government has implemented certain advice for the collective good. And lastly, it's also some of the measures that I talk about, including the fiscal measures, really comes because Singapore, we have been very fortunate in terms of our general country's wealth to put in place certain responses. I must come up front to say that the response that we put in place, some of it will not be replicable in other countries simply because of the wealth status of the country. So these are some of the measures that we have to bear in mind, that the measures that we put in place must be dependent on the context, depending on the current epidemiological situation of the disease in the country in terms of what ought to be done and what ought to be scaled up. So in summary, the ability and the inability for a country to respond during a crisis like this really depends on the decisions that have been taken in the past, whether it is to earn trust, whether it is to prepare the hospital facilities, whether it is in stockpiling of essential goods and services, goods and resources, medical resources. Those are absolutely essential. Right now, Singapore, we are continuing with our containment strategies. That includes detecting cases early through contact tracing, isolating them, trying to find ways to reduce importations. But at the same time, the country is preparing for mitigation. Measures that were taken very much context dependent. Success of implementation is also context dependent. Right now, there is, I think we still have some time before very widespread community transmission in the country. Equally, there are many countries out there which are seeing limited community transmission. You are the countries that you still have the time to prepare. Do not squander this time. And when I say don't squander, this is a checklist that I've put together in terms of what I mean by not squandering. Use this time, prepare your healthcare workers well in terms of training, in terms of equipment, seek help from countries like China or from the World Health Organization if need be. There's a checklist. I won't go through all of them, but equally, I would highlight that there is a link that I will also put forward. WHO has put forward a checklist for countries on how they should be preparing to respond at different phases of their epi curve. So with that, I think I will end, and I'm very happy to take questions right now. Thank you very much.
So, YY, I mean, I'm sure, I mean, had we been in person, there would be an enormous applause for you, but thank you so much for such a wonderful summary of the range of work that's going on. So we have about 15 minutes left, and we're going to try and be respectful of time. So I'm going to try and rush through some of these questions that have come in. There are a number of these. So YY, there's a series of questions around case definition. So as you're talking about cases, has case definition changed over time? Are these cases only those admitted to hospital, or are they also those with less severe or asymptomatic individuals? And then there's a question about what happened on the 6th of March, because there was a move from a kind of linear to an exponential trend. So anything on any of those questions that you can share?
Right. So on the case definition, early on, the case definition actually relied on people with previous travel history to the hot zones. And that means in parts of January and February, hot zones include China, parts of South Korea, parts of Italy and Iran. But gradually, the case definition expanded to include people with influenza-like infections, particularly with a confirmed pneumonia infection. And these are the people that we identify for testing. And you mentioned what happened on the 6th of March. Actually, on the 6th of March, this is where a large community cluster were identified, and those were groups of people that came together for karaoke sessions in February, and sufficient time has passed that an entire cluster of them emerged, and that suddenly showed a significant jump in the number of cases that were reported. Over, back to you.
Brilliant, thanks, YY. So there's a question from Kamal, and it says in the UK we're only encouraging those who are severely ill to see their doctor and get tested. It seems to be a very, very different approach in Singapore. So A, can you confirm that? And B, what do you think this will have on our estimates in the UK of the number of cases and transmission-related issues?
I think in Singapore right now, we have a very clear communication to the public. If people are ill with specific symptoms that are indicative of a coronavirus infection, they are firstly directed to one of the public health preparedness clinics, the GP clinic, specific GP clinics that are managing this, or equally, they could call a hotline to activate ambulances to come and pick them up. It is important for people who are feeling unwell with suspicious symptoms to seek medical help, and that is where the doctors will ascertain whether to follow up with additional testing or to send them home with a 5-day medical leave and with the clear reminder that they have to stay at home. And I should actually touch on this point that over the past day or two, Singapore actually changed its Infectious Disease Act to say that people who have been given a 5-day medical leave must stay at home. They will be breaking the law if they actually venture out of their home as well. So those are actually indications, firstly, to identify people who are ill and to try and minimize any onward transmission by letting them seek care and seek the necessary testing as early as possible. The second is also to remind people who are ill but not with coronavirus symptoms to really respect the need to stay away from the public, to even to try and minimize any onward transmission of any form of infection. Over to you.
So, YY, thank you. So the next question is from Bernard from Kenya, and he's asking about what are you doing to sustain your health force at this incredibly difficult time?
So that is a very good question, because at this very difficult time, it is actually the health force that will be overwhelmed by the load as well as the need to maintain a certain degree of protection and against any hospital infections. So what the country has put in place is that they have actually worked with the private hospitals as well to really enlist their assistant to help look after milder cases. So the most severe cases at the moment are still managed in most of the severe cases are still managed in the public hospitals. At the moment, we have yet to see a situation that our health system is overwhelmed. What that means is that we still have such capacity for intensive care units, we still have capacity for ventilators. So there is a degree of rotation among our healthcare workers that is aiming to preserve and to reserve their energy and attention for any subsequent big waves that the country will be facing. But in terms of protecting our health forces, we have made it very clear that we will prioritize the distribution of personal protective equipment to our frontline workers. So our hospitals, including the doctors and nurses in the 900 public health preparedness clinics, our primary care clinics, they have the necessary PPEs to protect themselves from infections in the healthcare setting. Over to you.
Great. So can I just ask colleagues who are listening in, so we've got around 30 questions and there's only a few minutes left. If you'd particularly like a question answered, can you upvote it? It appears higher up on my screen. So YY, this trace together technology, is it available for use in other countries or is it only confined to Singapore?
No, not at all. In fact, the team that has developed is a government team, and they are very happy to make this available to countries that are interested to use it. And my understanding is that the Trace Together team has actually actively been approaching other countries as well to share the technology, and they will share this technology freely without any IP rights to it. Because at this point in time, I think it is to the collective good that every country is able to manage this well. And I'm very proud that the Trace Together team is able to say this will be a public good. Any country that wants to use it, get in touch with us, we will share it. Specifically, people who are online who wants to learn more about Trace Together, who wants to get in touch with the team that are developing Trace Together, please reach out to me through the email address that I flash on the screen now.
Brilliant. Thank you, YY. So the next question is around policing and military levels. So challenges around enforcing distancing measures. So you know the UK well. I mean, do you know what your sort of policing and military ratio is in Singapore compared with the UK? Any sense of that issue?
I'm afraid I'm not too familiar enough to answer this question, so I would have to differ on this. But
Okay.
I believe, yeah, please.
Yeah, so the next question is around mental well-being. Any signs of sort of severe anxiety in the population, depression kicking in?
So anecdotally, we do not have official statistics yet, but anecdotally, we are starting to see an increase in reports on domestic violences, on also anxiety and people not coping very well, particularly among some of the more vulnerable communities, such as the elderly as well. Because when we start to put in place physical distancing measure, whether it is in Singapore or any other countries, the vulnerable communities will be the ones that are at highest risk. And because this is where volunteers who would usually volunteer in health elderly homes or healthcare homes, if they stop coming because of certain restriction, that is where it will impact. So at the moment, I do not have the numbers for a evidence-based discussion, but I do see anecdotally, we are starting to see increasing reports of mental distress in the society. Over to you.
Okay, so I want to get this question in from Dennis from Uganda, a really important question. What can low-resource countries do in this context? And because you've already mentioned that, I mean, this is some of what you're doing is even challenging for the UK board about low-resource environments.
Right, so this is a very important question. And I would like to emphasize that you have to look at what is the current situation in your country. I follow the epidemiological situation across different countries in the world. Quite a number of countries in low resource countries currently report fewer numbers of infections. Now, there are a few reasons that could be the case. A clear reason is that if they do not have sufficient testing capacity, clearly they are not able to report confirmed cases well. So it could be a situation that countries are already suffering from widespread community transmission, but they just don't have the capacity to test that. That's one possibility. The second possibility is that because of limited travels to some of these countries, they have been very fortunate not to see widespread community transmission yet. So I'm going to break up my response in different parts. The first part is really in terms of if the country genuinely have yet to see widespread community transmission, they are seeing sporadic cases, they are seeing small-scale clusters. This is really where the countries must try their very best effort to do contact tracing as best as they can and to isolate these people, the contacts of confirmed cases, as well as they can. Now, in the absence of the use of the availability of tests for sufficient testing, it is the best approach to treat every suspected case as a confirmed case. Isolate them well, and quickly trace the contacts well. In terms of contact tracing, in countries that have much less dense environment, there may actually be easier approaches to perform the contact tracing rather than to have to rely on complex methods such as the use of CCTV to really pinpoint in a densely populated environment. So coming back, countries right now facing small-scale spread, please continue to think about how do we identify suspected cases, treat them as confirmed cases, isolate them first, and isolate their contacts well. This would be very crucial in minimizing further onward transmission in the population. These are public health fundamentals. Now, in resource-poor setting, where there's widespread community transmission, I move to the second part of the equation. And that is where the governments may need to think about different varying degrees of lockdown mechanism, but lockdown is easy for us to say in words, but the country have to think about how do they manage people who are in different communities, particularly needy communities, vulnerable communities, people that may be living in slums that may not have the capacity to actually cope with a lockdown for 2 weeks or 4 weeks in terms of food, in terms of essential services or essential supplies. Over to you.
Brilliant. Okay, so we're at 10 o'clock. So Susan, can I just ask you to put the slide up of the forthcoming seminars? So first of all, I mean, YY, incredibly grateful for you making the time and working through these questions with us. I mean, we've advertised this for 1 hour, so we're going to be respectful of that. So for those of you who need to leave now, please do so. We realize, I mean, lots of people with pressing commitments, but these are details of the next 2 seminars that we've lined up. So, I mean, the first handbook on COVID has just been published from China, and so we'll be having the editor-in-chief of that, Tingbo Liang, speaking next Thursday. And then we're also lining up a presentation from Canada. So please put these in your diaries, and we'll. And if you have any suggestions of other people that you'd like to hear, please do get in touch through the Usher Communications channel. Everybody should have an email address from us. We'll be delighted to try and set that up. What YY has kindly agreed to do, if for those of you who can stay on and would like to, is just work through a few more questions. So what we'll do is we'll carry on for another 15 minutes for those of you who can stay on and would like to. So YY, there's, I mean, some more questions around case definition. So is this by symptoms or is it confirmed? And if it's confirmed, is this by PCR assay? And can you also take the question about why do you have, I mean, you've got a very low mortality rate, thankfully, but why do you think that's the case?
Right, so 2 questions there. The first is around case definition. Yes, I mentioned that all suspected cases are swabbed and then tested. In terms of testing, we use RT-PCR to confirm, and we always confirm with 2 tests. So someone who is proven to be negative, they have to be negative for both tests before they are cleared as a discharge. Otherwise, they will always be isolated until we are able to run 2 tests. In terms of mortality, I think there are a few reasons that Singapore, we have had lower mortality at the moment. The first, I have to pay tribute to our very excellent medical teams that are staffing the hospitals at the moment. They have put in a lot of effort to really manage patients coming in. And secondly, it's really, right now, we have the capacity to really identify people earlier on because of the contact tracing. And I think that the evidence is very clear. For the coronavirus infection, if we are able to pick people up at the early parts of the infection chain, infection cycle, that is where the prognosis is much, much better. And because of the intense contact tracing and testing, this is where we are able to identify people early on in the early stages of infection. And the last reason has to be that at the moment, our health system is not yet at a situation of being overwhelmed like what we're seeing in some European countries in the early parts in Hubei and also in the United States. Our hospitals, we still have the availability of resources such as intensive care units, such as ventilators, to take care of the very sick, the sickest patient that needs these resources. Equally, if Singapore now have a massive surge in the number of infections, particularly people that requires intensive care, I would think that our ability to keep this mortality low will be severely compromised if we are unable to give the necessary ventilators to patients that need it. Over, back to you.
Thanks, YY. So there's a question about the disturbing rise in the number of cases over the last few days. And does this mean that the measures that you've put in place are failing?
Good question, but because we have tracked very carefully where the cases are coming from, we at the moment, I'm concerned, but I'm not overly worried that there will be a significant community transmission that's happening. The reason is simple, because right now, the majority of cases that we are seeing in Singapore are mostly importation. If we look at the case numbers that are coming in the past week, about 80% of them are imported cases. These are returning Singaporeans or permanent residents from other parts of the world coming back to Singapore. And we know why that is happening, because with the global lockdown that is happening in different parts of the world, there are many Singaporeans or locals that want to come back to Singapore during this period. And that is when, if now we have a lot more Singaporeans coming in from hot zones, we naturally will anticipate that there will be increasing numbers of people who are coming back and have already been infected in their countries. Actually, to be absolutely honest, I expect the numbers to continue rising over the next 2 to 3 weeks because of the returning Singaporeans and permanent residents. But I hope that the trend continues, that it is importations that we are seeing and very little domestic transmission at the moment. Back to you.
Thanks very much. So Susan, can you just dismiss the questions that have been answered, please? So otherwise it's quite confusing at this end. But from the modelling, YY, what's the worst case scenario that you're working with? And from your modelling, how long do you anticipate before things return to any semblance of normality?
So our modelers have looked at the data and have modeled what is happening in Singapore. I would defer to the very strong teams of modelers in the UK, in Hong Kong, and in other parts of the world that have been looking at the global situation presently. So our modelers in Singapore have basically showed that our current measures without importation would be able to contain the transmission to a very manageable level. Now, what would the issue be is that even if Singapore is able to contain this, there will be the economic aspects of the coronavirus pandemic that countries will need to think about, because at some point, countries will need to start unlocking their national lockdowns. And that is when globally we will start to see second waves, third waves, and so on. In Singapore, we are very pragmatic. We know there will be second waves. We know there will be third waves. And the question is, how do we function as a society at the moment to allow life to go to resume as much as normal as possible, so that the core functions, including schooling, including working, trade and commerce, can continue while managing the risk. So you could say that we are moving to we are putting in measures to mitigate both the health impact as well as the economic impact. But very clearly, the models suggest that unless the world globally, we are able to contain the situation. Otherwise, all we need is just to have a handful of countries not being able to contain this well, and the world will continue to see the re-emergence of a coronavirus over and over again. Over, back to you.
Okay, so YY, maybe this is the last question, and I think we'll let you go then, but just on a slightly lightly-hearted tone, there's a question about what are Singaporeans doing to cope with that karaoke?
Oh, right. Well, one of the things that I like to joke about is that I do regret not investing in Netflix. Clearly, this is a time that we are encouraging Singaporeans and equally people in different parts of the world, stay at home, minimize your risk, but please maintain your mental wellness as well. Continue your daily exercises, continue eating healthy food as necessary, minimize your intake of alcohol, but watch Netflix if you want, watch TV. This is a time that families actually get the opportunity to come together and bond. So don't squander this time, this opportunity. Over, back to you.
Okay, so YY, we're so very grateful for you making the time and giving us such a timely and important talk. Also very grateful that you've agreed to take emails and answer any residual questions that are left. And really from all of us, very best of luck to you and colleagues in Singapore with dealing with this pandemic. So thanks very much indeed. Thanks everybody for joining, and we'll end the webinar here. Thanks so much. Goodbye.
Thank you very much. Thank you, everyone.